Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about innovation and equity in global health. But before we get into today's episode, just a reminder that we can't do this without your support. If you haven't already, please subscribe to our show wherever you get your audio podcasts. And we're really trying to build up our audience on YouTube, so please visit our YouTube channel at www.youtube.com/@shotarmpodcast. Like this episode, subscribe, and hit the notification button to be notified when new episodes come out. Now, this episode is about building trust and understanding how we motivate people to build awareness about the new technologies that are coming through in society. And we're on the road with the Global Listening Project again. And we're joined by the Global Listening Project's co-founder and chair, Professor Heidi Larson. Heidi, how are you and where are you?
Pretty good here in Palo Alto, spreading the word at Stanford.
Excellent. Well, it's great to see you. And we are also joined, I think, from London by Susie Barnes, who, Susie, let me make sure I get this right, is the Senior Vice President of Global Medical Affairs for the Vaccines Division of GSK. Susie, welcome to A Shot in the Arm podcast.
Thank you very much for having me, and you got it spot on. Thank you.
Thank you. I need to do a bit of a mea culpa because I promise you this never happens, but it did happen earlier in February where the three of us had a fantastic conversation, but the tech gremlins got in, and unfortunately, the recording that we did didn't make it from recording to editing. So we're going to have another go at it. But I'm sure, given how fantastic the last conversation was, we should be equally brilliant this time. But I want to start, if it's okay, about what essentially is this partnership here between the Global Listening Project and GSK. And Heidi, if I could start with you, and perhaps you could give some context to how the GLP and GSK came together.
Sure. I have to say that over the years in my work at UNICEF and then in the 15 years of the Vaccine Confidence Project, we had already built a long relationship with GSK, which does a lot of partnering with universities and earlier in UNICEF. And in 2021, we got a MacArthur Award at the Vaccine Confidence Project to expand the scope of our work on trust and understanding in the context of COVID. And that was fantastic. And it was in that context that GSK joined and partnered with that and matched that fantastic award to allow us to not just focus on the experience of 6 countries during COVID and who did they trust and who did they turn to, but we were able to expand too. And then Moderna also joined, and Gates Foundation, to reach 70,000 people around the world. So we've built a bit of a consortium around the Global Listening Project, trying to really capture and learn from this century. It's a rare event to have something like the pandemic, and we wanted to make sure we didn't come out of it without really understanding how people on the ground experienced it. And that's what the Global Listening Project is about. Not just with a reflection, not from just a historical perspective, but how can we do better next time?
And Susie, Heidi's referred to the sort of historic moment of COVID, but it's interesting, isn't it, that the ripple effect or the tsunami effect, perhaps, coming after COVID in the era after that has really emphasized the importance of getting to grips with the trust ecosystem. So, Susie, why was the partnership with the Global Listening Project important for GSK?
Well, I think Heidi's already mentioned that we've got a long history of working with her group, and at GSK, our focus is the goal is to get ahead of disease together. That means impacting positively over 2.5 billion lives by the end of the decade. And that's about prevention and treatment. And I'm incredibly proud to work for a company that has a very holistic approach to developing medicines and vaccines that can prevent and treat huge numbers of conditions from both the primary care, respiratory sector, right through to quite significant, serious conditions in the oncology world. I'm also, as an ex-GP, incredibly interested in the prevention aspect. And that's because I was working in an environment where it was about reactively dealing with sick patients. There's something hugely important about prevention as a fundamental tenet of healthcare. And that means thinking not only the vaccines, but the holistic approach of what we do now when we're 30, 40 or 50, how it makes us healthy when we're 80. And vaccines actually are an important part of that. And remember, as the world gets bigger and we get older, actually by 2030, there's going to be an increase in by a third of people over the age of 60. And I think people over the age of 60 already overtake the number of people under the age of 5 globally at the moment. So we have to think about managing our society, managing individuals' quality of life, not just the length of their life. So the partnership, carrying on what we've done, but learning about the power of prevention is going to be incredibly important for us as an industry, but no one group can do this together, no one company, no one industry. It's got to be with governments, with private sector, with the healthcare communities, the patients and the consumers and the people who are receiving these healthcare interventions.
And I guess not forgetting communities and the patients, civil society, who are going to be beneficiaries and ultimately partners of getting the shot in the arm or wherever. But Susie, you said something very interesting about having been a GP. And for our listeners and viewers from all parts of the world that may not know what a GP is, do you want to explain that? Because I think that's really important to your understanding, your worldview of the trust ecosystem.
Of course. So quick correction. I was a GP just over 16 years ago, for about 5 years. I think being a GP it's a general practitioner or a family practitioner for those in different parts of the world. And every different healthcare community and ecosystem has a slightly different approach to it. But essentially GPs are the gatekeepers. They're the people that members of the public will go to when they've got a condition. And it's a jack of all trades. But as we get older, we have a growing population. The pressure goes up on the system, and that means you have less amount of time with patients. You need to know something about everything, and you need to know what the next course of action is. And of course, prevention in a community that you're working in as a family practitioner is incredibly important, because there's masses and massive opportunities to help prevent diseases, whether it's chronic diseases around cardiovascular disease, for example, with healthy eating, with exercise, managing our blood pressure. But it's also about thinking about life course immunization, your immunizations as a child, as an adolescent, but also as we get older. And we could perhaps talk a little bit more about that later on.
Super. Thank you. So where do you think we are now, 2025, on the state of trust in what is a rapidly evolving world of technology? We have the mRNA vaccines that were so important for COVID. And I suppose all of us having a degree of frustration in the decades before that, because mRNA was being developed hopefully for HIV vaccines, but never delivering in the way that we wanted. Heidi, how do you see the world as it now stands?
Well, we have a lot of data on that thanks to the Global Listening Project. And, we just also published one of our first articles really analyzing it in Nature based on the data from the Global Listening Project. And the title of the article is that science's biggest problem is not is loss of influence, not loss of trust. And we kind of stacked, because with the Global Listening Project, we tried to investigate all kinds of who do people trust, who do they turn to. And trust is high in science, but it's even higher with GPs, and it's higher than that with families. And then we also look at religious leaders. We look at a whole mix of employer. I think that's one of the gifts of the Listening Project is it goes much wider. So we've learned a lot, but a lot of people in the world don't have a GP. It's becoming an increasing luxury to have. I mean, frankly, even in the UK, in the area I lived in the health center that you're attached to, depending on your geography, I don't think I ever saw the same doctor. And that's not unusual in the rest of the world. I mean, in the US, you do develop with a GP, but it depends. So that trusted strand again depends on where you live. But whoever say if there is an equivalent of your GP, your personal doctor, or maybe the one you are more frequently seeing in the health center. But a family is huge. I mean, the influence of family, and in Africa, religious leaders. So these kind of different levels of trust. It's really kind of compelling.
And I suppose you mention Africa, but in between health professionals and families are community health workers that played such a crucial role, first in HIV, but then were deployed in so many countries, Kenya, for example, Tanzania, in being the frontline troops for COVID. Did the GLP see attitudes towards those community-trained health workers increase, decrease, or even be considered in the research?
Yes, we included community health workers, and they were. I think people at the end of the day trust people that are closer to them, geographically or socially. I mean, even if your family is in different parts of the world, you trust them. Depends on the family, of course. Different families are different dynamics, and certainly community health workers also have a big role. But at the end of the day, in decision-making, GPs were higher where you had one. Yeah.
I think it was interesting, actually, in the Global Listening Project, where it was very clear that healthcare professionals do come out very, very high, and scientists in terms of trust. And I think there's study after study that has shown that they still are the most trusted group.
But I think what's interesting with the Global Listening Project is that in terms of actions, in the terms of the final decision, they trust those two sources. But then when it comes to decision making, they turn to their family, they turn to others. There's a kind of ecosystem of influences that we have to pay more attention to.
In a sense, it must be quite frustrating because we've had 2 centuries, I guess, of rapid evolution of vaccine technology, from the pox all the way up to these mRNA technologies and even vaccine light, if you like, from sort of long-acting therapies that are almost vaccines in the way that they function, providing half-year or year-long efficacy. Susie, where do you see this going in terms of the technology, and your level of comfort or discomfort on where we are given the ecosystem that we now live in?
So it's such an interesting time to be in the vaccine space because of all the numerous disruptive technologies. You mentioned the smallpox. It's 1797 that was the very first vaccine that we saw. Some interesting practices, I think, from the Egyptian times. Really, the smallpox is the most kind of recent one of this time. And I think smallpox to this day remains the only disease that has been truly eradicated. But if you think about the impact of vaccines as a technology over 200-year period, we've managed to control and eradicate diseases significantly. And that's why I think post-COVID, you see vaccine hesitancy, probably a little bit more kind of political appetite and opinion around vaccines. It's important to go back to what vaccines offer us. They still are only second to clean water in terms of the effectiveness as a population health intervention. And I think that is something that's huge. And so that kind of illustrates why it's important. And I actually want to talk a little bit more about that, because we mentioned life course immunization. We have had pediatric vaccines for a long time. We have had travel vaccines for a long time now, less so around adult vaccination. And if we think about the society that we live in, it's getting older. Common infectious diseases, whether flu, pneumonia, and obviously now COVID. So we're not only more susceptible, we're more susceptible to the complications, risking hospital stays. At the same time, in parallel, we're also considering all the other chronic diseases we get, cardiovascular disease, diabetes, and so on. Those diseases at the same time put us more at risk of infectious diseases. And so it becomes a kind of a little bit of a vicious cycle. And so we go back to, how do we think about preventative care being the core and the foundation of treatment and management of our populations throughout the life, and being healthy when we're 80. So everything we do now in our 30s, 40s, 50s will really impact us in a positive way. And there's been quite a lot of research on the impact of this, not only on life expectancy, on quality of life, but significant research done on the reduction in costs of healthcare costs in the healthcare community, increased productivity, and general kind of improved benefits to kind of the socioeconomic climate in various geographies. And there was a think tank in Europe last year, so the Ambrosetti think tank, that showed that for every €1 you invest, you get something like €4 back from those kind of prevention and approaches. So I think it's incredibly important that we think about it holistically and not just as an individual thing to think about as we go through our lives.
And that sort of data that you're getting back from think tanks like that are so crucial, because proving the impact of prevention is so difficult from a health metrics perspective, as opposed to evidence generated from curing or ameliorating a disease. And it sort of gets us to something I'm really passionately interested in, and which essentially brought about the creation of a Shot in the Arm podcast. And that is how we communicate, how we interact with as many people as possible, bring an understanding of the fruits and the challenges of science to society. And I wonder what your thoughts are about the role of communication strategies in building a stronger sense of understanding to society about the values of clinical science. I've been giving this a lot of thought. I come from the HIV movement, and way back when, we were extremely skeptical of the medical community. I mean, I started off as a member of the community advisory board at the Royal Free Hospital, and our job was to be really skeptical of every single clinical protocol that came our way. And I see some of that trickling through as a foundation for some of the skepticism, hostility that we see today in the and they're not so deepest and darkest reaches of the internet. They're very much at the forefront now. And so I'd really love to get both of your thoughts on how we adapt our communication and engagement strategies for this third decade of the 21st century. And again, Heidi, perhaps I could start with you first.
Well, we couldn't have eradicated smallpox today in the strategies we used when we eradicate it, because we have very different populations now. They would have never tolerated the kind of somewhat, not in the beginning, not in general, but certainly towards the end, there were some more forceful approaches, let's say. And it had an incredible value, and that justified, at least from the public health community, the nature of the, you really have to take this approach. And I think one of our challenges is the nature of publics today, also feeling hugely emboldened with, the world of information at their fingertips. So I think we clearly need new strategies. We need new allies. And as Susie said, in the case of vaccines, we have a very different target then. It's different with babies, where there's, and children, where you have routine visits and it fits in a regular interaction with the health system. The populations we're trying to reach now, from HPV to pregnant moms to older people, and now with a lot more personalized medicine and different approaches, we have to engage differently. And I think the public health community has been super anxious and hesitant to get into the social media space, to go in the places where people are getting their information, who are exchanging. And we need to get with the program, so to speak. We've pretty much rolled the red carpet out to alternative voices because we didn't want to go there. I mean, if you get, if in a, surveys we've done with public health departments, like, are you using social media? It's like, oh yes, we send out appointment reminders. Well, that's not going to cut the cake, I mean, that's helpful if you're willing to go get, the vaccine or the appointment. But so we need to think differently. And also that landscape is also changing dramatically, especially with AI. So we've done in our own work a lot of innovation with chatbots. Because another thing we've heard from people is, the little flags that come up in when you Google anything related to vaccine. It's like, well, go see your NHS or go see CDC or go see WHO. And parents say, we've been there. They just don't have the answers to our questions. And so to be responsive, we need to know what the questions are. And that's where kind of the chatbot approach can be helpful. But also we need to be loaded with the right answers. But so it's going to be in a exchange. And, GPT, for instance, is not, doesn't have the latest all the time. I mean, even yesterday I was giving a talk at Stanford, and I was just looking to make sure that my data was up to date about state of measles in Europe. Fortunately, my last look was right. My memory for the last check was correct, but in GPT, it only gave up to 2024. Whereas if you went down the links to WHO, you got 2025. So even, the AI that's supposedly all ears is not necessarily up to date. So we still need multiple strands of listening. And I think, but also being responsive to that. So we also need to get new partners. Vaccines and medical interventions have been particularly much more narrow, much more linear, and just let that noise walk by. In HIV, one of the things I loved about it, having worked in AIDS before coming into vaccines, it was engaging everyone, partly because we didn't have drugs. We still don't have a vaccine. But when I came into the vaccine world, it was so narrow, even within the vaccines. I mean, it wasn't even, I do vaccines, I don't do cardio. It's like, I do measles, you do HPV. So I think we need to throw that out and really look at the context and get much more engaged with where people are, what matters to them.
I mean, I feel we're at a point historically where what we have through Dr. Google or Dr. X is transitionary, is not where we're going to be even in 5 years. I think the industrial revolution, the tech industrial revolution, is going to bring so many changes. And I think one of those changes is going to be around how we think about the therapeutic relationship that we as patients and as consumers of healthcare have with our healthcare professionals. And so, Susie, I wonder, as you look at the way the broader communication ecosystem has with doctors and patients, healthcare providers and consumers, where you see things going.
I just want to say that I agree with everything that Heidi's just mentioned, and it's such a complex world that we're living in, and I agree things are going to just change at a rate of knots. But I also just want to call out the HIV community, I think, is an exemplar in terms of how the communities work together. In terms of vaccines, I agree it is probably more homogenous in terms of how we access vaccines and how we access information. And I think it's not just about accessing information, it's accessing healthcare itself. So it's not traditionally just going to see your GP. There's a lot more already happening virtually, but again, there's nothing uniform. There's a real postcode lottery within a country, let alone the globe. But if I think about vaccines and what gets the shot in the arm, to reference this podcast, it takes an army in a huge amount of time. Not only, if you think holistically, we've got to have the funding, the recommendations, the access, but then you've got to ensure that you have a consumer, for want of a better terminology, at the end who has got the information to make that decision. And now to have so much noise from them from all over the internet, they also need to trust their doctor. So we need to make sure that their doctors are fully informed, and not only that they have checked their own beliefs and are feeling confident in what they're sharing with their patient, but they've got to believe in it as well. It's very difficult for an HCP to recommend something that they don't necessarily believe in. And I think that's the world we live in. So from an industry perspective, I think it's imperative that we can be seen as a trusted source of information, but we cannot be a trusted source on our own. I think then just laying on top of that is how you actually access vaccines. It may be through your family practitioner, but you've got the challenges of time and multiple other problems to deal with. It could be the specialist. You've also got the pharmacist in some areas. So you've got the access, then you've got the belief, the understanding, the knowledge, the facts, and the ability to have a really good conversation to ensure that your patient or your consumer really, really does trust you to help them make that decision.
And the flip side of that, Susie, is I think we all have to pay attention to how science is communicated to lay audiences. As things have become much more complex, we haven't necessarily thought about how these concepts reach people, how they are digested and how they are understood. I mean, I think of the R0 conversations during COVID and how so often that was misunderstood. I mean, I don't even know that I could necessarily, just in lay terms, describe that right now. But it does speak to the need to think about, if we have a new technology that is coming out, as well as thinking about how we present it in ways that are factually accurate, or that are accurate insofar as our regulators have approved them. We also have to think about how people will understand them.
Agreed. So I think that comes down to content, but also that content being in a format and a channel that is right for individuals. And there's no one size fits all, and we're increasingly seeing that. And it kind of goes back to your previous question, to be able to, and Heidi mentioned it, we need to know what the questions are. So we need to be listening, and the Global Listening Project was foundational in this. But for vaccines, it is more complicated. It's very different from being told you've got a disease, here is a drug that's going to treat that disease. People haven't seen measles and months for years. They don't remember when people were becoming profoundly deaf or dying from measles. But unless we think about how to truly listen to what people are worried about and then get information, maybe in multiple different ways that they can trust. And I think there is a lot of polarization in society around, in particular, vaccines. There's some very, very strong voices out there. And again, I think Heidi's mentioned this. How do we ensure that there are strong but trusted voices to meet those head on and ensure that we can create a healthy choice for patients and better understanding? I really don't think this is an easy problem, though.
No. And it sort of speaks, Heidi, to the establishment of the GLP. Maybe at the start, we all thought that the GLP was so important about how we come out of COVID and those questions of who do you trust and who do you turn to. But perhaps the GLP is now even more relevant in the context of measles, in the context of a long heritage of vaccines that has perhaps taken the institutional memory in people away from the risk of measles and other diseases that led to such an intense vaccine campaign 50 or 60 years ago.
Your question is, how do you motivate people without that? I mean, right now we have, I think it's over 127,000 cases of measles in the European region. And that's no small bit. I mean, it's clearly more in the European part, although scattered. I just did a book review of a new book called Boosters, or Booster. It wasn't actually probably the best title for the book, but it was really about measles and the history of measles, because the book, I think, would get a much wider audience to read it with a different title. But at any rate, it was, I think if people understood measles better, because measles infection is not just about measles. You don't just get sick of measles. It causes something called immune amnesia. It wipes out your body's memory of exposure to other illnesses, and it makes you more vulnerable, which is why, for instance, when I was in UNICEF, we would also give vitamin A, which, in itself is not doesn't prevent illness, but mitigates the serious effects. And I hadn't personally even fully understand the impact of what he talks about in the book is immune amnesia, and that can go on for years. It does recover at some point, but it has a broader impact that people, I think, maybe that would help them understand how serious measles is as an infection, and not just one to run out and go to a measles party for. But I that's one of our challenges with prevention in general is if you do it well, you don't see your success in the same way as when someone, as Susie points out, when you're not feeling well and you want to feel better, you'll take risks. Just make me feel better.
And I think you see a difference. I mean, you probably saw this in when you were actually doing the interviews around the world, Heidi, but the different parts of society have a very different approach to risk and personal rights versus societal responsibility. That makes a big difference in terms of communication and the approach to things like prevention.
So Heidi, that is an interesting point that Susie has made, that balance between individual rights and societal responsibilities, communal responsibilities. To what extent did the Global Listening Project pick up on those tensions or those balances in different societies?
Yeah, it's interesting. When I was in UNICEF, working a lot on the Convention on the Rights of the Child, we used to talk about, because particularly some people would talk about my rights. And also there were tensions between what adults felt were appropriate rights for children. But we did always talk about when your individual rights have a limit where they start to harm other people. And I think that notion of not just societal rights, but when you talk about when your right starts to cause harm, that's a whole different thing. In our global listing project, we did ask people, and even in our broader work on vaccines, about would you take a new vaccine or would you take X vaccine for yourself? And would you take it for others? I mean, if it had a protective value for others. And thankfully, gave me hope in the world. There were always more people who would take the vaccine if it additionally had a societal benefit. A number of them took it for themselves, and if it was only for themselves, some people would skip it. But when it had that additional benefit, so that was kind of good news. I mean, not kind of, but to me, that was good news that the general sentiment is people do care about it having a broader impact. I mean, initially in their own families, but in their communities and other ways. I'm not saying everyone is like that, clearly. And one of the challenges is that some of the people who are the questioners or refusers are sometimes clustered in communities, and that creates this gap in protection.
So where do we go from here? What's next for the GLP? What are you going to do with the consolidated learnings and findings? Heidi, you mentioned an article in Nature, but how are you going to socialize the learnings, both for communities, for public health officials, but also for partners like GSK?
Well, we've been spending, and you were along for a good part of that last year, a lot of road time last year, going to different countries, sitting around the table with different health and other people from different sectors to socialize the data, to get feedback on the data we collected before we moved into writing it up, because we wanted to make sure that some of it seemed like they might be outliers, but we were consistently got feedback. It was, no, that's what it is. And it was heartening to see that it resonated with people. Some of them were, felt like, wow, we really need to work more on X or Y, because we asked lots and lots of questions about also broader societal impacts of the COVID measures, like impact on kids' schooling. Did you lose your job? Did you lose an income? Were there mental health issues, loneliness? A whole mix of these societal impacts of these, broader measures of control. And it was, and then also, of course, about vaccines. So now that we've done that, feedback in that extensive number of roundtables in different parts of the world, we are writing things up, but also very much looking at more than just getting publications with this and getting the word out, that we are, as we say, from data to action. We really want to look at, okay, in the places where we saw that they were less resilient, had more issues, or had really serious drops in vaccine uptake or confidence or other aspects of their health. That another question we had asked is, did you miss your routine appointments for other things? And so in places where there's more resent and less willingness to cooperate because of an experience in COVID, we want to go to some of those places and design interventions that, or better understand, what would help to start to get people back. We're not going to go back to what we were before COVID. I think we need to accept that. There has, the dam has broken in terms of the flood of, there were a lot of people before COVID who had no idea about all of the toxic stuff online about vaccines or even on other health interventions. And COVID, between locking people up and, the kind of constant pressure to take vaccines, everybody was looking. And so many people have told me that they had no clue that there were any questions about vaccines. And that COVID just were a bit of a shock to them, that people were actually, which was interesting because, we assumed a lot more people knew about the different views, but that wasn't true. So I think we really need to move, to get on board with where people are now. And so we've picked some settings within the broader global data, different ones, and working with those communities right now, looking at different ways to build, to get engaged. So trying to move more into the action space. Well, not trying, we are.
And Susie, for GSK, where next in building resilience in the trust ecosystem?
Yes, I think we've all learned so much from COVID and the experience. I think we learned some really positive things from COVID. I think we learned how we could make things happen quickly, how we could leverage technology, how we could come together and collaborate to overcome it. But I think there is a lot we learned which Heidi's just mentioned, that we need to overcome that mounting trust gap. And so for us, I think continuing to partner with Heidi and the Global Listening Project. Great to hear about the Nature paper and all the other activities that are going on. But I think we need to continue our learning and journey. And I think from an industry perspective, we have to ensure we are incredibly responsible with information that we share. We've got to keep on listening. It's really, really important that we listen and we understand why that person in the US or somewhere in Europe is worried about vaccinating their child or vaccinating themselves. It's really, really important that we don't ignore that. So we have a number of initiatives within GSK to continue that work. But ongoing partnerships, obviously, with Heidi and the team is going to be important.
Brilliant. Well, we wish you both the best of luck, and please come back and keep us briefed and the lessons that you've learned. I think you really are doing the Lord's work. Nobody else is thinking this way, and it's so crucial to building healthy societies where there is a truly balanced relationship between clinical science and communities. So thank you so much for coming on the podcast today.
Thanks, Ben.
Well, that's it for this episode. Thanks to Susie and Heidi. Thanks also to our director and producer, Erica Spera of A Shot in the Arm Media. Now, at the start of the episode, I said that we couldn't do this without you. We're hugely grateful for your support, and if you haven't, please do subscribe wherever you download your audio podcasts. And don't forget to check out our YouTube channel. It's at www.youtube.com/@shotarmpodcast. Give us 5 stars and hit that notification button so we can let you know when we upload new episodes. Finally, have a great week and a safe week, everyone.